Well, greetings to you. I'm Dr. Kirby Clements with Carla Williams here, and it's a cold day here in Georgia, but we're going to be talking about something that's going to warm your heart and your mind, and it's answering some fundamental questions about Medicare. And I think, Carla, one of the critical things is the Medicare drug coverage plan. What is that about?
Yeah, it's usually called Part D. And that's the plan that's going to cover any of your prescription drugs. Okay. So, you know, for most of us, we want to make sure that we have a Part D plan. And one thing that I might mention, too, is that if you elect not to have a Part D plan and you, when you're eligible and you come back later to get one, then you can be penalized for waiting to get that Part D coverage.
So any Medicare plan doesn't cover prescription?
Not necessarily. You know, there are Medicare plans that only cover Part A and B. There are plans that, like, for example, the original Medicare is a good example. You only receive Part A and B, and you don't have prescription drug coverage. But there are other, something called a PFS plan that also doesn't cover prescription drugs.
Now, I've heard about levels of drug coverage. Now, what is that about, and how does that work?
Right. Well, when we talk about levels of drug coverage, we're normally talking about tier levels. Many of you may have heard of that or be familiar with that with your current health care plan. But all drugs are given a tier level on a scale of 1 to 5. So a tier 1 drug is generally what would be called like a preferred generic drug.
Okay.
All the way to a tier 5, which would be considered a specialty drug. I call them designer drugs sometimes, but the more expensive drugs. So the tier levels are really based on how expensive the drug is.
Okay.
And then you have a copay or co-insurance that you would need to pay when you get one of those drugs. So you're going to have a lower copay on the lower level drugs, a higher copay or co-insurance on the higher level drugs.
I can see that. That makes a lot of sense. One thing I've had to stay away from is donuts. Obviously, I don't love them, but I can't eat them. But there's something called a donut hole in reference to Medicare. What does that mean?
Yes, that's a term that's probably not the official term, but what we call it is the coverage gap.
Okay.
And what happens is that as you're paying for medications, if you get to a certain point, you can fall into what's called the coverage gap or the donut hole. And let me tell you a little bit about how that works. As you're paying for drugs along the way, if you get to the point where the total cost of your drugs is $3,750, then you enter what's called the coverage gap or the donut hole. Okay. And what happens when you get to that point is that you begin to pay more for your drugs, essentially. And you're generally paying a percentage of the cost of the drugs, which could be as much as 44%.
Wow. Right.
So during the time while you're in that coverage gap, you're paying for your drugs at that rate. Now, how long do you stay in that gap? You stay in that gap until you have paid a total of $5,000 out of pocket. So when you get to the point where you've paid $5,000, then you come out of the coverage gap and you go into what's called catastrophic coverage. And essentially in catastrophic coverage, now your copays are going back to a much more manageable level. They are generally going to be less than they were even when you began. So you're going to have low copays or low co-insurance when you get to that point, and that's where you would stay for the rest of the year.
Now, will any Medicare plan cover all of my drug prescriptions? You
know, it's possible. You know, the important thing to realize is that you need to find out before you sign up for a plan. You know, your agent, you can find out whether or not your drugs are covered by that particular plan. So, you know, you don't want to sign up for a plan that's not going to cover all your drugs. So clearly you can see that all plans don't cover the same things. Every plan has what's called a formulary, a drug formulary, and that is a list of the drugs they cover, and it also shows what tier level those drugs are on, so you have an idea what it'll cost you.
Well, you answered a little bit of this. So if someone is shopping for Medicare, I mean, in reference to drug coverage, what are some of the things they should look for? You know,
right. Well, clearly that's the most important thing. Okay. That is, are my drugs covered on this plan? First of all, and then too, I mentioned the fact that each Medicare company has different tier levels for different drugs. They're not all exactly the same. Many of them are, but you want to take a look and see what tier level your drugs are going to be on.
Okay.
You know, very often a tier 1, in some cases you may not pay anything in terms of coinsurance.
Well, now this is just most insightful here. I'm a dentist, as you know, a prosthodontist. Sometimes when patients come before me, they're asking different questions about, many times about just very same thing. Some of them go different places to get different opinions, basically. If you had a last word or last comment to say to the people out there, because this is most insightful here, what would you share with them? What would you share with them? Yeah.
You know, I would just say, again, that it's important to have someone help you navigate the process.
Okay.
And make sure that your plan is going to cover all of the things that you need, because you do have quite a variety of plans available to you, and you want to ensure that, first of all, that all of your drugs are going to be covered. You also want to check to make sure that your doctors and your hospital are on that plan, because that can make a difference too.
Wow.
Right, so you want to check that out before you get any plan.
Well, this is a wealth of information here. I know, and I can almost say I wish my mother had heard all of this here, and I wish we had heard all of this early here. If they wanted to get in contact with you, Carla, how would they do that?
Yes, well, you can reach me at Carla for Insurance, that's CARLA, the number 4, and insurance @gmail.com.
Well, you've got information here, and there are other videos we have on that, and you've heard a wealth of information. So I'm Dr. Kirby Clements here with Carla Williams here, and we've had a long-awaiting discussion about something that affects us all, and look forward to seeing you again on some very vital topics.